Hi everyone, Tom here from Physio Inc. So I'm just doing a little bit of information about ITB friction syndrome or runner's knee, so pain on the outside of the knee when you're running. Now, we used to call it ITB friction syndrome, but it turns out there's not a whole lot of friction going on there. They've looked at cadaveric studies and seen that it's actually not much friction going on there at all. And the real reason why people get pain isn't because of friction, but compression. So compression of the fat pads that are underneath that ITB. So the things that are going to cause more compression are, when you're running, that you're in single leg stance, so you're in this bit here and the knee's coming across a little bit more because it starts to compress that pad there. The other thing is when you start to drop this hip down, because the ITB starts up here and goes down there, when you start to drop the hip, you get lengthening of that tissue there and compressing on the outside of the knee. So, a couple of really quick exercises you can do. Number one is fix that hip drop. So one way that you can start off, and this is just a starting point, is just by standing on one foot, making sure that your hips are nice and level, and then just passing a weight around your body. You will probably find, if this is a problem for you, that you'll start to get a real burning and real fatigue sensation on the outside of the hip within about 10 seconds. Okay, if you're a bit better, you should be able to do a minute, and I'm just taking it easy here. I've just got a 3 kilo weight, nothing too crazy. You should be able to do this for a good minute with good control, okay? So that's a good way to get the hip control going as a starting point. Now, the other thing that you can do is start to increase the load tolerances of the tissues around the knee. So one easy way to do that is to do a Bulgarian split squat. So 1 foot up onto a bench, and then you're coming down and you're doing a split squat, but you want to focus on putting most of your weight on this back leg. So this looks a bit like running, incidentally. And it's a really good way to put some load on the outside of the knee there. So to build up that tolerance. So just coming down, doing your split squat, coming back up, but focusing on putting as much weight as you can through the back foot rather than the front one. So nice, smooth, controlled movement. And it's as simple as that. So 2 exercises that you can start to get onto. They are just starting points. You can definitely go a lot further with them, but it's something for you to check out. Good luck with it, and let us know how you go.